Hi everybody, my name is Hilary Booth and I'm a naturopathic doctor and welcome to my video blog. Today I want to talk about depression, but before I get going with my topic, I just want to again remind you that it's November, meaning that you only have about a month and a half left before your health insurance runs out for the year. So if you do have remaining health insurance dollars that you can spend on a naturopathic doctor, I would recommend that you book an appointment with me as soon as possible so that we can get our first few appointments in before the end of the year, and we can start tackling whatever health issues it is that are bothering you in your life right now. Again, whether it's anything from acne and skin over to digestion to mood, like we're going to talk about today, or hormone health, I'm here to help. You just have to book an appointment with me, and I'd be happy to go through that with you. So today, as I mentioned, I'm going to be talking about depression. According to the Canadian Mental Health Association, 8% of Canadian adults suffer major depression at some point in their adult lives. And depression can affect every aspect of the person's life, and it can affect every person very differently symptom-wise. And so a lot of times this isn't talked about, and it's swept under the rug and overlooked as something, but it is very important to talk about mental health and to understand what's going on with you, why you might be experiencing this, and that there is help and support out there in order to get your mood back on track. Now, to be diagnosed with major depressive disorder, you need to fit under a specific categories and medical criteria, but a lot of people don't experience necessarily major depression, but they do have concerning mood changes. So whether it be that you're experiencing low mood on a daily basis, or minor depressive disorder, or major depressive disorder, it is important to seek care. Now, many times if you're diagnosed with depression, you're going to be put on an antidepressant. Now, however, antidepressants are very powerful medications, and they can cause lots of side effects, everything from weight gain to flat affect, to low sex drive, to fatigue, to low appetite. These things can really profoundly affect you in a lot of negative and other ways in your life. So as a naturopathic doctor, my first step is to see what can we do in order to treat your depression without needing medication. And then as a second step, I'm always okay with using antidepressants if we need to, in order to get you through whatever it is that you're going through in your life right now, in order to make sure that you're doing okay with your mental health and that your mood is being looked after. Because again, it is a very important facet of our overall health. Now, these antidepressant medications, they're also very difficult if you've been on them for a long period of time to wean off of them, because they can cause major rebound depressive effects. So it's kind of a catch-22. The antidepressants help you get through your depression, but then when you come off of them, your depression's worse than it was before. So again, as a naturopathic doctor, I try to look to other things first, and that's what I'm going to be talking about in my chat today. But I also have lots of tools that we can use in order to help you wean off of your antidepressant medication under the supervision of your prescribing physician, and help to mitigate some of those side effects and rebound and depression that you may be experiencing. So I'm going to cover 5 different things that as a naturopathic doctor I look for and treat to help alleviate your low mood or depression. The first is talk therapy. You always, 100% of the time need talk therapy if you're experiencing low mood. Now you can seek care from CAMH or from the Catholic Family Services, and you can also go to different free clinics across the city. But as a naturopathic doctor, we are trained in cognitive behavioral therapy as well as talk therapy and counseling in order to help to give you a different perspective as to why you may be experiencing the moods that you are. It helps to give you a deeper understanding of the events in your life and the way that you react to them. And it allows you to develop coping mechanisms in order to improve your mood, but also help to improve your outlook on things in your life. I like to use acupuncture at the same time as talk therapy. A lot of times I find for my patients it allows them to relax and to really integrate with their body and their mind and come to a place of better understanding with the acupuncture needles in while we're doing talk therapy. So it's something unique that a naturopathic doctor can offer you in terms of talk therapy. My second naturopathic perspective on depression is that exercise is really underutilized but very effective for treating depression. Now, the reason why this works is that exercise triggers endorphins. And now endorphins are basically the hormones that are released in your brain that attach onto opiate receptors. Now these opioid receptors in the brain are the same receptors that are targeted by morphine and heroin and oxycodone. Now these drugs, you may have heard of some of the effects that these drugs have, and these basically will cause an elevated mood, a feeling of euphoria, and decreased pain perception. Now, all three of these things are extremely effective, actually, ways of treating depression. And it's a really, really effective thing to do to get a natural way of stimulating these receptors and having these feelings of euphoria and better mood and decreased pain by exercising. So exercise will release the endorphins in your brain, and all you need is 20 minutes 3 times per week. It's really, really simple, and you don't need to be doing anything too intense. It can be anything from a brisk walk or yoga through to boxing or swimming. It's up to you. It's just something that you need to get going and get doing, and once you do, you will stimulate that natural endorphin release to boost your mood from a physiological level. Now, my third tip from a naturopathic perspective is to target nutrient deficiencies. Now, nutrient deficiencies are really, really common, and they're often overlooked, and they can cause depression, full stop. So you may have an organic depressive disorder, but it may only be because of nutrient deficiencies and nothing more. So the first nutrient that I always look at is omega-3s. Research shows that with the depletion of omega-3s in the diet, we actually see an increased instance of depression. And research also shows that with targeted omega-3 treatment, or supplementation, you can alleviate mild to moderate depression without the use of medications. Now, omega-3s, what you need to be looking at is the EPA that are in your fish oils. Most of us don't eat enough fish on a daily basis in order to treat depression, so that's why I recommend taking fish oils. Now, the omega-3 you need to be looking at is the EPA, and you need at least 2 grams per day of that to treat depression. My next one that I look at are B vitamins. You can do lab testing to see your B vitamin status, but research shows that B2, B3, B6, B9, which is folic acid, and B12 all can cause depression when they're deficient, and you can treat depression by giving those as supplements. Alternately, we can look at your diet, and we can try to augment your intake of B vitamins just through dietary measures, and it will have a major effect on your mood. The next nutrient that I look at is magnesium. Now, interestingly, study shows that supplementation with magnesium will alleviate major depression in just 7 days, which is almost mind-blowing to think that something so simple as magnesium can have such a profound effect as to alleviate depression without the use of medication for 7 days. Now, the next one I look at is lack of protein. Protein is what your body needs in order to build neurotransmitters. Now, neurotransmitters are basically the hormones that control mood, among many other things in the body, and your body needs protein from dietary sources in order to build these neurotransmitters up. So you need to have at least 40 grams of protein, if not more, depending on your body weight and size, in order to be getting enough protein to be building the neurotransmitters in your brain to boost your mood. So again, that's 40 grams a day of complete protein sources. The next one I look at is vitamin D. Now, lack of vitamin D can cause something called seasonal affective disorder, or sort of the winter blues, winter depression. And this is basically because living in the northern hemisphere, we don't get that sun exposure in the winter. And the sun exposure causes vitamin D to be produced in the body, and vitamin D deficiency can cause depression. So during the winter months, I recommend my patients take even a small dose of vitamin D per day can help to prevent and alleviate seasonal affective disorder type of depression. Now, the next thing that I look at as a naturopathic doctor in order to heal and treat depression is to heal the gut. So 90% of our serotonin, which is our major mood hormone, is produced in the gut. And if you have food intolerances, inflammation, irregular bowel habits, and leaky gut syndrome, you basically are going to be producing enough of the serotonin in your body in order to have the proper mood elevations that we're looking for. So as a result, you experience depression or low mood. Now, basically, in order to treat depression from a medical perspective, typically they will give you something called a selective serotonin reuptake inhibitor, which is the drugs, the antidepressants that you get that boost the amount of serotonin that is in your body circulating all the time, and that helps to elevate your mood. As a naturopathic doctor, all we need to do is heal your gut so that your gut can produce the serotonin on its own and give your body the hormone that it needs in order to elevate your mood naturally and over the long term. And so I do this a couple of ways. We can treat for food intolerances, we can change your diet, regulate your bowel movements, put you on a good probiotic, and help to give your gut the building blocks it needs to heal back up. and start producing the serotonin again. The fifth and final tip that I have from a naturopathic perspective about healing depression is that there are lots of targeted herbs and nutrients that as a naturopathic doctor I can prescribe to you, but they really have to be used on an individual case-by-case basis because some of them can be quite overpowering and they can be dangerous when used inappropriately. So research does show that these herbs can treat mild to moderate depression as effectively as antidepressant medications without the side effects of antidepressant medications, and with the ability to wean down off of those drugs so that, again, your body can to start developing its own elevations of mood without the use of external things like drugs and supplements and those kinds of things. The therapies are extremely effective, and again, they need to be targeted specifically for you. So if you are experiencing low mood, I would encourage you to book an appointment with me, and we can look at some of the more targeted and more intensive therapies that are available from a natural perspective to treat low mood. Now, I'm going to do a quick little recap of the 5 tips that I have from a naturopathic perspective to treat depression. Number 1 is talk therapy. Number 2 is exercise, and all you need is 20 minutes 3 times a week. Number 3 is to address nutrient deficiencies because they are often a really simple cause of depression that is overlooked. Number 4 is to heal the gut so that your body can produce its own serotonin and help to elevate your mood. And number 5 is to seek naturopathic care so that your naturopathic doctor can give you more intensive and targeted therapies to treat your depression. So again, I would encourage you to book an appointment with me by going to www.drshaunaderoux.com or by calling our office to book that appointment. And again, I would recommend that you book the appointment before the end of the year so that we can use up your benefits and then have a fresh start of benefits to work with starting in January. As always, thank you so much for watching, and I really hope that you found something interesting and useful here today. If you have any questions or comments, please feel free to contact me directly, and I'd be happy to help. Thanks very much, everybody. Have a great week.